stuff. You can. All right, good afternoon, everyone, and thank you for your patience. We are about to start our briefing now. Thank you for joining the city's Philadelphia's response to COVID-19 daily briefing. Today, all of our speakers are joining us virtually to adhere to social distancing guidelines, and we will begin our briefing now with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much. Good afternoon, everyone. Today, I want to start out with a few words about moving to the yellow phase on Friday, June 5th. Tomorrow at this time, we will be announcing details on what that phase will mean for residents, visitors, and businesses alike. The staff of the Health Department, Commerce, Emergency Operations, Law, and other departments are working right now on protocols, guidance, and a new order. So hang tight. We'll have all of that for you tomorrow. For now, though, I do want to focus on one specific topic. I know there's a lot of discussion throughout the city about an immediate return to outdoor dining on June 5th. We have even seen some restaurants post signs and ads announcing their plans. I want to be clear. We are still evaluating how outdoor dining will be implemented in the city during the yellow phase. We hope to announce guidelines for that next week. In the meantime, no restaurant should be announcing plans to launch outdoor dining on June 5th. We need you to wait to ensure that our protocols can be followed. Outdoor dining done properly in the midst of a pandemic is extremely complicated. It obviously needs to adhere to social distancing guidelines. But we also need to ensure that the public right of way is respected and that those with disabilities are not hindered. And we need to ensure that outdoor dining protocols are equitable, that they work as well in Juniata and East Oak Lane as they do in Center City. Believe me, I'm as anxious as all of you to once again enjoy the great food that Philadelphia restaurants have to offer. But we need to ensure that this is done properly. We appreciate the patience of our business owners, and we will have specific guidance on the question next week in advance of June 5th. You'll recall that last week we hosted PHL Love, a concert to support the PHL COVID-19 fund. I want to thank all the performers, media outlets, and the Middleton family that made the show possible, and all of you for tuning in. Today, I'm pleased to announce that the show raised over $1.5 million for nonprofits throughout the region. That brings the total raised by the PHL COVID-19 fund to over $17 million. As you know, grants from the fund aid nonprofits that are on the front line of the pandemic. These grants are allowing the nonprofits to continue providing community safety nets, such as food pantries and health services, as well as preparedness and protection services, such as hygiene supplies and access to accurate information. And later today, the fund will announce a sixth round of grants, providing nearly $2.5 million in a new round of grants to 85 organizations. That brings the total distributed since the fund was started only 2 months ago to $15 million, granted to 468 organizations. This effort has been a tremendous success, and we're thankful to all the organizers. If you want to donate to the fund, go to phlcovid19fund.org. That's phlcovid19fund.org. Thank you to everyone for your generosity during this difficult time. Speaking of generosity, I'm also pleased to announce that beginning tomorrow, Philabundance will operate a weekly drive-through food distribution in the parking lot at Citizens Bank from 9 a.m. to 1 p.m. This new food site will build on the city's partnership with Philabundance to address food insecurity. Over the last 2 months, the 40 food sites supported by the city, Philabundance, and the Share Food program have distributed more than 258,000 free boxes of food to residents. At the drive-through site, Philabundance plans to distribute one 35-pound food share per vehicle while supplies last. The distribution will be open every Friday through June 26th. No ID or proof of income will be required. However, we want to note that this site is drive-through only with no exceptions. This requirement will support social distancing by limiting interactions between clients, volunteers, and staff. People cannot access the drive-through site by car should call 311 for help finding a food site or food pantry. There's also a map of existing food sites available online at phila.gov/food, phila.gov/food. We are grateful to Philabundance for continuing to respond to hunger in our region, and we're proud to support them in operating the site. We also want to thank the Phillies for hosting the site in their stadium parking lot. Now I'll turn it over to Dr. Fardy for his updates.
Thank you very much, Mayor. We're continuing to see progress against the coronavirus epidemic here in Philly. Since this time yesterday, we confirmed 175 new cases, bringing us to a total of 22,150 since the beginning of the epidemic. Those numbers are continuing to fall, the daily numbers. We're continuing to see progress in the outbreaks. We're seeing in congregate settings. Our nursing homes are seeing fewer sick people. Now, nursing homes are starting to do more screening of asymptomatic people, so we expect to see more cases of infection that are uncovered. As far as the number of people who are coming down sick, that number is dropping. Likewise, in the city jail, we've had 0 new symptomatic cases. We are doing additional screening, and so we would expect to find more cases when we do that asymptomatic screening. As soon as that screening is complete, we're going to compile the numbers and we will report that to you. The city's hospitals, as of yesterday afternoon, we were reporting 485 inpatients in Philly hospitals with coronavirus and 994 in the Southeast Pennsylvania region. Those numbers are a little bit increased from where we were yesterday. That was after about 3 weeks of decline. We think that there may be just a data reporting problem, but that's something that we're going to follow closely. We don't want those numbers to go up. We want them to continue to go down. Excuse me, since this time yesterday, we confirmed 10 new deaths from the coronavirus infection, bringing us to 1,258 since the beginning of the epidemic, of which 666, or 53%, were nursing home residents. Now, testing, as I've said before, we're encouraging people to get tested. Anybody at any age with new onset of respiratory symptoms should go in and get a test. That's a cough, a fever, or sore throat, or any difficulty breathing. Likewise, we added people who don't have symptoms, but who have had a known or suspected exposure to someone with coronavirus in the previous 7 days. So we may be able to pick up asymptomatic infection in people who are exposed. Those sites are where people can get tested, or www.phila.gov/testing. Now, let me talk a little bit about contact tracing. Contact tracing is going to be very important as we move into the next phase. I thought I'd give you a sense of where we are today, because I know there's much interest in that. We're working on 3 different approaches to this. One is to have the contact tracing done by paid staff. The other is working with a partner healthcare organization, such as Penn Medicine. The other is working with volunteers, individual volunteers, or volunteers working with an organization, such as public health students. All those, by the way, follow the same basic process, that someone who's reported as a case would get an interview to find out who they've been exposed to. Those would be called their contacts, and then those contacts would be spoken to and advised to stay in quarantine so that if they get the infection, they don't in turn pass the infection on to others. As far as the 3 options, the paid staff, the partner healthcare organizations, and volunteers, let me talk about each a little bit more. Paid staff will be hired through nonprofit organizations that provide simply the administrative function of hiring the staff, doing payroll, doing benefits, like a staffing company. It's back office functions only. These staff will be supervised, managed, supported, and led as if they were city employees. So that this will be, functionally, they'll be our staff. We chose this mechanism in order to hire people quickly. You know, it takes months to hire a city employee. We don't have months to wait. We need to get people on board quickly. And other governments around the country are using similar mechanisms of staffing arrangements like this so they can get staff on quickly to do contact tracing. As far as the partner healthcare organizations, we're right now working with Penn Medicine, and they are doing contact tracing in coordination with us for patients who are diagnosed in their health center or their health centers. And that's something which right now is just with that one organization, but we may be working with other healthcare organizations like that in the future. As far as volunteers, as I said, public health students have come forward. Organizations that have groups of students have come forward. We have the Medical Reserve Corps volunteers. They may assist with contact tracing as well. We have not used them for that purpose yet, but we may use them for that purpose in the future. What's happening right now with contact tracing? We're in the process of developing our protocols and piloting these protocols, some with our own staff, and then working with Penn Medicine on what they're doing. We're in the process of putting in place the software for this. Software is something which seems kind of mundane, but this process involves a lot of information flowing in many different entities. So you need to have good software in order to be able to track it all accurately. We're involved in hiring, and all that we hope to have in place, put in place over the next few weeks. We'll give you more info on this as we get more in place. Then for everyone in the city of Philadelphia right now, just to remind people, right now we are still under a stay-at-home order, but we are getting closer to a stepwise gradual restart on June the 5th. I would have to add, though, that's if our numbers continue to improve. If we were to suddenly take a turn for the worse and see many new infections, I would want to reconsider that. We will present a plan for how to do that and guidance for businesses and for average people in Philadelphia tomorrow on how to do that safely. That will involve, many differences in the way the businesses operate and the way that individuals operate. For businesses, we'll be reducing the numbers of people involved. There'll be barriers between people so that the droplets can't spread from one person to another. There'll be spacing, the use of masks. For Philadelphia residents, it boils down to three things: masks, distance, and hand washing. We're going to give you much more detail on that tomorrow. So that's where we are today. For more information, www.phila.gov/COVID or 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We are now going to move to Armando, who will deliver the Spanish language translation of both the mayor and Dr. Farley's remarks. Armando.
Mensaje del alcalde Jim Kenney para el miércoles 27 de mayo del 2020. Buenas tardes a todos. Hoy quiero comenzar con algunas palabras sobre nuestra transición a la fase amarilla este viernes 5 de junio. Mañana, a esta hora, anunciaremos detalles sobre lo que va a significar esta fase para las empresas, nuestros residentes y visitantes. El personal de los departamentos de salud, comercio, operaciones de emergencia, legal y otros están trabajando en este momento para formular protocolos, orientación y nuevas normativas. Así que anunciaremos toda esta información el día de mañana. Por ahora, quiero centrarme en un tema específico. Hay mucha discusión en toda la ciudad sobre la posibilidad de ofrecer servicio al aire libre en las veredas de los restaurantes. Incluso hemos visto que algunos restaurantes están haciendo promoción de estos planes. Quiero que quede muy claro, todavía estamos evaluando cómo se implementará este tipo de servicio al aire libre durante la fase amarilla. Esperamos anunciar las pautas al respecto próximamente. Hasta entonces, ningún restaurante debe anunciar planes para promocionar servicio en mesas al aire libre a partir del 5 de junio. Cenar al aire libre en medio de una pandemia es algo extremadamente complicado. Obviamente, se necesita adaptarse a las pautas de distanciamiento social, pero también debemos asegurarnos de que se respete el derecho de los peatones y que las personas con discapacidad no se vean obstaculizadas. Y también debemos asegurarnos de que los protocolos y la normativa que regulen el servicio al aire libre sean equitativos y que esto funcione tan bien en Juniata y East Oak Lane como en Center City. Sinceramente, estoy con tantas ganas como ustedes de disfrutar una vez más de la excelente comida que los restaurantes de Filadelfia nos ofrecen, pero debemos asegurarnos que esto se haga correctamente. Agradecemos la paciencia de los dueños de negocios y les daremos orientación específica sobre este tema la próxima semana antes del 5 de junio. Pasando a otros temas, ustedes recordarán que la semana pasada organizamos PH Love, un concierto para apoyar al fondo PHL COVID-19. Quiero agradecerles a todos los artistas, a los medios de comunicación y a la familia Middleton que hicieron posible el espectáculo y especialmente a todos ustedes por sintonizarlo. Hoy me complace anunciar que el concierto recaudó más de $1,5 millones para organizaciones sin fines de lucro en toda nuestra región. Esto eleva el total recaudado por el fondo PHL COVID-19 o PHL COVID-19 a más de $17 millones. Las subvenciones de este fondo ayudan a muchas organizaciones sin fines de lucro que están luchando contra la pandemia. Estas subvenciones permiten que estas organizaciones continúen brindando apoyo a la seguridad comunitaria con despensas de alimentos y servicios de salud, así como suministros de higiene y acceso a información precisa y necesaria. Hoy, en horas de la tarde, el fondo anunciará a los beneficiarios de su sexta ronda de subvenciones, que repartirá casi $2,5 millones a 85 organizaciones. Con este monto, Este fondo ya habrá distribuido $15 millones a 468 organizaciones desde su creación hace solo 2 meses. Este esfuerzo ha tenido un gran éxito y todos estamos muy agradecidos con los organizadores. Si usted desea donar al fondo, vaya a phlcovid19fund.org, es decir, phlcovid19fund.org. Gracias a todos por su generosidad durante este momento tan difícil. Y hablando de generosidad, también me complace anunciar que a partir de mañana, Philabundance operará un centro de distribución de alimentos bajo la modalidad de autoservicio o drive-thru en el estacionamiento del Citizens Bank Park de las 9 de la mañana a 1 de la tarde. Este nuevo sitio de entrega de alimentos es el resultado de una alianza de la ciudad con Philabundance para enfrentar la inseguridad alimentaria. En los últimos 2 meses, los 40 sitios de entrega de alimentos respaldados por la ciudad, por Philabundance y por el Share Food Program han distribuido más de 258,000 cajas de alimentos gratis a nuestros residentes. El centro ubicado en el Citizens Bank Park, Philabundance, tiene planes para distribuir 35 libras de alimentos por vehículo hasta agotar sus existencias. La distribución estará operativa todos los viernes hasta el día 26 de junio. No se requerirá identificación ni comprobante de ingresos. Sin embargo, queremos señalar de que este sitio, sin excepciones, solamente será accesible en automóvil para facilitar el distanciamiento social, al limitar las interacciones entre los residentes, los voluntarios y su personal. Las personas que no pueden acceder al sitio en automóvil pueden llamar al 311 para obtener ayuda sobre cómo encontrar un centro de alimentos o una despensa de alimentos. También hay un mapa de los centros de alimentos existentes disponible en línea en phila.gov/food. Esta información se encuentra disponible en español. Estamos muy agradecidos con Philabundance por ayudar a mitigar el hambre y la inseguridad alimentaria en nuestra región y estamos orgullosos también de apoyarlos en la operación de este sitio. También queremos agradecerles a los Phillies por alojar este centro en el estacionamiento de su estado. Y ahora pasamos a la actualización en materia de salud para el día miércoles 27 de mayo del 2020. Desde ayer se han confirmado 175 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 22.150 casos en la ciudad. La tendencia es clara. Hay una disminución en el número de casos. También hay avances en la evolución de los casos en los entornos grupales. No tenemos nuevos casos del COVID-19 en las cárceles y actualmente reportamos solo 2 casos confirmados. Los hogares de ancianos se encuentran realizando pruebas ahora en pacientes asintomáticos y se espera que se reporten más casos debido a que se están haciendo más pruebas. Hoy, tristemente, reportamos 10 muertes por el COVID-19 en la ciudad. Un total de 1.258 personas han muerto por el COVID-19. 666 o el 53% de estas muertes han sido en hogares de ancianos. Les recordamos que este virus no discrimina por raza o por género. Les informamos que hasta ayer en la tarde, 432 personas han sido hospitalizadas en Filadelfia y 866 personas en la región sureste de Pensilvania. Las pruebas están disponibles en casi 50 centros ubicados a lo largo y ancho de la ciudad. Usted puede ubicar el centro más cercano a su domicilio yendo a phila.gov/testing. Les recordamos que las pruebas están disponibles con cita previa. Y alentamos a todas las personas de cualquier edad que tengan fiebre o problemas respiratorios a realizarse la prueba del COVID-19. Si usted ha estado en contacto con un caso confirmado o sospechoso del COVID-19, les exhortamos a realizarse la prueba. Quisiera brindar mayor información sobre el programa de rastreo de contactos. Estamos contemplando 3 enfoques: contratar personal, establecer alianzas con organizaciones del sector sanitario, como por ejemplo Penn Medicine, y establecer una red de voluntarios. El personal se contratará a través de las organizaciones sin ánimos de lucro. Estas organizaciones cumplirán solamente funciones administrativas como nómina o beneficios. El Departamento de Salud Pública de la ciudad supervisará al personal que se contrate. Y estamos ya muy cerca de la reapertura de nuestra ciudad y gradualmente volveremos a la normalidad a partir del 5 de junio, pero sí y solo si los números continúan mejorando. Les vamos a presentar el plan completo de la reapertura el día de mañana. Nuestro retorno a la normalidad significa que habrá muchos cambios para la actividad comercial. Hay que reducir el número de personas dentro de los establecimientos. Hay que acostumbrarnos a respetar las barreras de plexiglas en las cajas de los supermercados y en espacios donde se atiende a una gran cantidad de personas. Hay que seguir manteniendo y respetando la distancia social. Tenemos también que normalizar el uso de la máscara o cubierta facial al salir de casa. Hay que recordar que mi máscara te protege a ti, tu máscara me protege a mí, así que úsala, por favor, porque solo juntos podremos superar este gran reto. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the press. Please remember we do have limited time during these briefings, so only one representative from each outlet is permitted to ask questions. Reporters are asked to also limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those logged in today, please use the raise your hand feature. It can be found under the participants list. And we will now move to unmute reporters one by one to ask their questions. And we will start with Rob Kushner at NBC 10.
Mr. Mayor, I'm a sports producer, so I'm going to start with a question that's a little different than what I'm assuming you're accustomed to.
Thank you.
I figured you would be excited by that. So it's really 2 questions. One, Governor Wolf opening sports yesterday. Theoretically, if baseball can get it together and get its house in order, has a chance to have a spring training at Citizens Bank Park. A, I'm just curious your reaction to that as a baseball fan, but B, would love to know if you think that's something safety-wise that can happen. And then secondly, the other sports news that developed today that involved the city, Malcolm Jenkins is going to be the commencement speaker to Philadelphia Public Schools. I'm just curious why he was the selection and what he'll bring.
Well, let's start with Malcolm. Malcolm has been a terrific player for the Eagles for a long time. He's in the community all the time and is doing good work in the community. He's well known. He's well spoken. He gives a good, energetic speech, and I think that the fact that I'm sad to see him go. Honestly, he was kind of like hitting to the Dawkins kind of level, where we're so used to him in that backfield making those big hits. But he's active in the community and he has an opinion, and he's concerned about policing, and he's concerned about community safety. And I think he's a great choice. When he first left the team, I called him, to tell him I was sad to see him go and wished him well. And he said he was going to maintain his home in residence in Philadelphia and would be involved in Philadelphia issues going forward. So I think he's on every level, as a player, as a person, and as a community contributor. I think is a great selection. As far as baseball is concerned, certainly as a fan, I'm dying to see it come back. At least be able to sit at home and watch it on television if there's no fans. And as long as everyone feels, both the ARC health commissioner and the state health commissioner and the teams feel that they can train and maintain their social distance and be safe. And I assume it's going to include wearing masks. As long as everyone agrees that we're taking all the precautions possible, I'd love to see them come back.
Rob, I think you unmuted there. I just want.
Thank you. Yep.
Okay.
I'm all set. Yep.
Okay. All right. Next, we're going to go to AD Amorosi.
Thank you, Mayor. You started off the conference saying that restaurants are sort of jumping the gun when it comes to the potential going yellow on June 5th. Are you surprised, though, that so many outdoor restaurants and so many restaurateurs are sort of chomping at the bit to get to business, get to work?
Absolutely. I understand their desire to get back into the swing of things, get their employees back, pay their rent, pay their bills. Totally understand that. It's just that when you're in the public thoroughfare, when you're in the public space, we have to make sure that we cover all our bases when it comes to accessibility, to safety, and to all the medical protocols that are necessary to keep everyone safe and not to slide back into code red or into the red phase. So, I mean, I'm not saying that's not going to happen. It most likely will happen. We just want to make sure we have all our I's dotted and T's crossed so that everyone remains safe and we can do this whole thing in a productive way.
Thank you, Mr. Mayor. Question number 2. I just wanted to confirm. I was on the phone on the call the other day, and we discussed the budget. And I'm curious about two things. Number one, what is the final date for when everything regarding the 2021 budget will be confirmed?
Is that it?
No, well, the second part of the question is, have you heard, I know that David O. and other city council members are asking for you to reconsider the arts office and arts, culture, and creative economy. If that could be reconsidered or moved.
Well, the second part of the question, if they want to reconsider that cut, then they have to come up with other cuts that would replace the money that those cuts are saving. I mean, this is not rocket science. The columns have to add up, and they have to add up to a balanced budget. And if you think that arts and culture are more important than some other area, then that's the will of council, and there's 9 votes for that. We'll work with it. But I mean, you can't just willy-nilly say put this back and not give a path to putting it back so
Sure.
the budget remains balanced. And what was the first question? Was what? First part?
The first question is, when is the drop dead date?
We're supposed to have the budget to PICA, I think 30 days before the end of the fiscal year. So probably by sometime in the end of May, mid-June, we'll probably be potentially not making the 30-day requirement for PICA, but we have to have it passed before the end of the fiscal year.
Thank you so much, Mr. Mayor.
Thanks, AD. We're going to move to Chad Pradelli now of 6ABC.
Thank you, Mayor. First question, complaints to 311 about recycling not being picked up have quadrupled in recent weeks. Do you think going bi-weekly recycling was a mistake? And explain why you did it.
Well, from an operational standpoint, I'll ask Brian to supplement that. I know there's been some anecdotal issues relative to trash being missed or not being picked up on the required day. I don't know. I'm not a sanitation operations person. So, Brian, you have any thoughts on twice a week recycle or once every 2 weeks recycling?
Yeah. So, I mean, this was not a choice that we wanted to make, but had to make because of our staffing levels. As we talked about a number of times, we've had staffing shortages in our sanitation crews as they're trying to work through their family lives as it relates to COVID-19. And that caused us to move to every other week recycling pickup. We certainly know that it's caused delays. We've talked about that a number of times at these press conferences. And so we're not going to deny that. We're running recycling and sanitation collections about a day behind most weeks on recycling weeks. We're going to continue to monitor the situation. But right now, unless our staffing levels improve and our attendance improves, we can't go back to every week collections. It's not feasible right now.
So, Brian, as you know, it looks like from the streets department data that the call out for sick outs for the sanitation department have exploded in recent weeks since you've gone to the bi-weekly pickup. Do you have a COVID infection problem in the sanitation department?
No, we don't believe that this is related to COVID infections. And to be fair, our attendance issues began immediately. First of all, we've had attendance issues in sanitation for a number of months. So this isn't new. They were exacerbated. Well, let me actually back up. We had attendance issues. Our overtime was trending higher in sanitation when we had our emergency kind of salary provisions in the last 2 weeks of March. Those attendance issues disappeared. And then when that time and a half was no longer offered, our attendance issues reappeared. And so I think we certainly have an attendance issue in sanitation. It's something that the commissioner and myself and our labor folks are talking through on a regular basis. But until we are able to address that labor issue, we're not going to be able to address our collection times. I said on this call and have said on a number of times that if COVID infections impacted city services or public safety, we would say so. That's not the case here. That's not the issue that we're facing.
Thanks, Brian. Thanks, Mara. This last question is for Dr. Farley from a colleague of mine. If the infection numbers don't slow down, what is the chance we don't go to yellow phase on June 5th? And I guess this would be for Brian or even the mayor on this. And what would that mean for the economy?
Well, I would simply say that, if the numbers continue to go down, we will go there, go to yellow on June 5th. But I want to just reserve the possibility if the numbers get bad that we may not go there. And certainly we want to open up. We want it to be better to get the economy restarted. But the virus is unpredictable. It has plenty of surprises in front of us. And so I want to be able to get that idea out there in case we have to have that happen. And even as we go through subsequent steps in this process, there may be times when we have to backpedal because the virus has started to cycle up again, and we need to prevent that. We're learning as we go. Everyone in the globe is dealing with this epidemic. So I just don't want to give people a sense of certainty when there's always a certain amount of uncertainty.
So what would you say? What would be an uptick? I mean, could you give us a sense in terms of maybe a ballpark number that if we did have an uptick, that would give you pause?
I can't. Certainly, if the numbers doubled, I would be very concerned.
Okay. And I guess this would be for the mayor to follow up with my colleague's question. Obviously, if we don't go June 5th, I mean, what do you think that does for our economy here in Philadelphia?
It doesn't help it, but you have to determine whether the economy is more important than people's health and lives. I mean, that's, from my perspective, whether it's frustrating for people or not, from the very beginning of this situation, or almost from the very beginning, because I was a little off base in the early stages of it, and we decided to lock down within 10 hours after the state did. But as this has progressed, it's clear that if we don't abide by the data and the numbers, we're going to have more death. And I understand the economy is extremely important. God knows we're dealing with this new budget and all the other realities. But when you're dead a long time. And I don't want to see more people die than is necessary.
Thank you, everyone. That's it for us.
Thanks, Jed. We are going to move now to Laura McChrystal of the Inquirer.
Hi. I'm wondering, based kind of also on that last question that was just asked, are there any other metrics other than, whether the rate of new cases continues to decrease that you're looking at to determine whether Philly will be ready for the yellow phase? And are there any metrics you would develop that that you would hope the city hits by June 5th to reach that yellow phase?
There are additional metrics that we are looking at and that we'll be looking at, and we're going to present those metrics tomorrow. And we will not set specific targets because I'm not quite sure how this is going to unfold, but at least people will see what set of numbers we're looking at.
Okay. And if Philadelphia were to decide, if you were to decide that the city is not ready for the yellow phase, would that be something done in conjunction with surrounding counties and state officials, or could the city potentially decide on its own that it's going to remain under the stay-at-home order?
My understanding is that Philadelphia has the authority to do it on its own, and we certainly are working in communication with counties around us, and we would certainly talk to them about whether that's necessary for us to go different ways.
But the numbers are improving, and we're hopeful that we continue on this trend, and let's see what happens as we get closer to June 5th. I mean, I'm not going to be totally negative about it because I can see where this conversation is going. But the point is that we need to be realistic with people. And we need to be upfront with people as to what we believe is in the best interest of the safety of our citizens. And I'm hoping and praying and encouraged that we can get there on June 5th.
Okay. And my last question is, Dr. Farley, do you agree with the governor's decision to stop using the metric that was set of, however many cases per amount of population over 14 days in order to move into the yellow phase?
I always thought that having a decision based on that one metric was too narrow. We should look at a whole set of metrics. I think that they may have been looking at a whole set of metrics, but they weren't publishing all of those. If you look at metrics that other organizations have published around the country, they often look at not just the number of cases, but also the trend in cases. And then when you're talking about going to what we're calling yellow here, what you want to achieve in metrics depends on what yellow actually means. Yellow is something that's really pretty narrow. It's just a limited restarting of some activities. It's not a total reopening of what we did before. So I think there should be more than one metric, and I didn't think ever that one metric that got a lot of attention should have been everything.
Okay, thanks.
Thanks, Laura. We are going to go now to Denise Clay of the Philadelphia Sunday Sun.
Good afternoon, everyone. I know that you're probably tired of, the whole topic of whether or not the city should move into the yellow phase, but here I am. I guess my question is, I understand you don't want to talk necessarily about what metrics the city is using, but let's be honest here. You can't be, too surprised that you have city residents who are in some ways kind of confused, because 1 minute we're being told that you have to be down to a certain number of cases, and now we're being told that we don't even have to pay attention to that anymore. I guess, what are we doing to let residents know that we're not just, thinking off the top of our heads here, or we're not thinking about something that has nothing to actually do with public health?
I don't know what.
I'll be happy to take that. So, first of all, Philadelphia could not go to the yellow phase unless the governor says that we could, right? So that we were definitely tied to whatever decision the governor made. It is still my understanding that Philadelphia could be more restrictive than what the governor is allowing. However, if the governor says that we are allowed to open on June 5th, then it is up to us to consider whether we think it is safe. And we have reviewed it and said we do think it is safe to have this narrow restart of activities, as long as we're following closely what we do, to try to balance out the health risks of the epidemic with the not just economic but also health risks of continued damage to the economy. These are tough balances. There's a certain amount of uncertainty to it, but I think it is appropriate for us to look at that balance. So once the governor said we can do that, then we looked at that and said, does it make sense for Philadelphia? I think it does. We'll lay out a plan tomorrow about how we do that safely.
Now, are you sure that the city and the governor are on the same page when we're still here, when we're still getting over 200 cases of new infections? Every time we have one of these things, we've had exactly one time or maybe two where we have been under 200 in terms of new cases. Are you sure that the city and the state are on the same page here?
The governor is saying that Philadelphia can open up. We're on the same page that, okay, if the governor's saying we can open it, we can look at it and see, does it make sense to us? We do think it is safe for us to take this first step. Again, we'll lay out tomorrow what that first step involves. There's a lot of safety features built into that and a lot of monitoring. We should recognize also the uncertainty. If it turns out that we do that, and we see an increase in viral activity, we may need to retrench. We need to be honest about that. However, I do think that if the numbers continue to look good between now and then, that's the right decision to make.
Okay, so I'm going to go back to a question that I asked earlier this week. Is there a plan B in case, we move to the yellow phase before we're ready and all heck breaks loose?
The plan at any stage in this is if viral activity starts to cycle up again, that we have additional restrictions to try to prevent that viral activity. I can't tell you what they would be because it may depend on what type of activity it seems to be leading to the increase in infections. But absolutely adding more or retrenching on restrictions or adding more restrictions is the plan B. And in every city, every state, every country in the world has that option out there. They have to have that option out there. We're all learning how to deal with this new virus. And as you open up restrictions, it may be that you go too far too fast at any point and need to back off. If we don't take any steps, we'll never know what's doable. And we do have, there are consequences to us never allowing economic activity to occur.
We're hoping for the best.
Okay. All right. Thank you.
Thanks, Denise. Now we're going to go to Jack Thompson with Metro.
Hello. This question is for Brian Abernathy. So if I'm understanding this right, you're saying the staffing shortages in the sanitation department is some type of protest or some type of dissatisfaction by people on the job?
Look, the worker that the sanitation folks do is hard. It's manual. They are coming to work and putting themselves at risk. And at the same time, they have families that are at home, many times trying to do schoolwork at home and homeschool their kids. So I'd say that there's a host of issues that our sanitation workers are facing. I don't know ultimately what the reason our attendance is down. I could just lay out the facts of what patterns we've seen, but certainly aren't begrudging our workers. I know the folks who are out there are working hard. I am worried about some of them getting burned out. And have concerns about that. We're going to continue to try and make sure that we find a way to get our staffing levels back up and improve our services for our residents.
Okay, thank you. And for the mayor, I think some residents might see the what you said about the outdoor dining, and they say, well, Governor Wolf and the state released guidelines on this yesterday. Why can't the city just follow those?
Because our numbers are different. We're in a more concentrated population, and we want to make sure that. I mean, this is complicated, but it's simple. We don't want people to get sick and die. I mean, that's what we're worried about, and we want people to get back to normal as normal can be. But we will see the next few days how the trend is, and we'll make a decision in what we think is in the best interest of public health.
Okay, so I'm going to take a shot at that too, Jack. Second Street in Old City is a little bit different than Second Street in Harrisburg. The density is different. The number of restaurants are different. Our sidewalk widths are different. And making sure people can walk down those sidewalks and remain safe and make sure, to the mayor's point, that folks don't get sick matter. So we want to make sure we get that right. In some cases, that may mean we have to make adjustments to the curb line or other issues, and that's what we want to make sure is done well. And as he said in his opening remarks, we want to make sure it's done with some equity, right? We don't want to treat folks in Old City or in Wash West differently than we're treating folks in Ogonce or in Fair Hill or West Philadelphia. So we need to do this thoughtfully. We need to do it quickly, and we have a team of folks who have been working on this for a couple of weeks, and they're going to continue to work on it until we get it right.
Okay, thank you. Those are my questions.
Thank you, Jack. Now we're going to go to Ryan Briggs with WHYY.
So I have two questions here. First, some city council members have been critical of the administration for failing to contract with minority firms during the COVID crisis. Some have said that the city could suspend certain procurement rules to distribute funding more equitably to smaller contractors. Questioning more the city could be doing to equitably distribute contracts.
So, question over because you were broken up.
Yeah, I think it's around equity of contracts.
My question is there anything more the city could be doing to equitably distribute COVID-related contracts?
So, Mayor, do you want me to take a shot at this?
Yeah, take a shot because I want to make sure they understand where my role is in this too.
Yeah. So I think we are making an effort to equitably distribute contracts. So I want to put that out there first. But if we look at our largest expenses as they relate to COVID, our largest contracts, they were around PPE. And frankly, we entered into contracts on personal protective equipment when we found somebody with personal protective equipment and didn't have the luxury of waiting for another firm to open up. A number of supply issues were like that. The specialty supplies around the Leah Core Center and the medical supplies that were related there. And I think the other issue I would say, the other, property managers would be another large expense. We have contracted with a minority vendor for our COVID prevention site. The speed that we needed people to be able to staff up and operate also created some challenges for some of our smaller minority firms. And so I think we'd all agree with council's desire and want for us to improve our minority contracting as it relates to COVID. And I think we're at a point where we can probably make those some of those improvements. But I do take, Monday morning quarterbacking at this point, I would say it isn't helpful, and it is really just laying a platform for future ambitions for some members of council.
There's a process that's going on now. It's ongoing. And it's important to understand that when I first came into office, I made a decision I was not going to get personally involved in the awarding of any contracts. I think that's inappropriate for me to be picking or looking at picking people that I like or people that I want to have contracts. So on all this situation for the last 4+ years, I've never, anointed a contract. There's a process that's going on now. It's dependable. It is a diverse group of folks in the government looking at and vetting responses to proposals. And they'll come up with a decision, and we're working with everyone we can to make that happen. But this is not something that we can bend. I don't know what bend procurement rules are. I mean, I don't think it's legal.
Yeah, and I actually do want to make a note there. For the mayor's comment, is we still have to have a competitive process. The federal guidelines require us to have a competitive process, and so it's not like I can just go hand out contracts to anybody I want to. Is we actually do have to go through a process, even if those procurement guidelines are truncated. We still need to go through that work.
The other issue is this is not $92 million in 1 year. This is over 2.5 years for both expanded testing and contract tracing.
Yeah, so, and I think we've handled that in a separate venue too.
Yep.
Aren't there some provisions for no bid contracts for smaller sums of money, like sub $100,000?
This is federal money.
Yeah, so this
for other funds, because the city has its own pot of money for COVID response, correct?
So the city allocated $85 million and appropriated $85 million for our response. That was appropriations authority, and we do expect most, if not all, of that money to be refunded by the federal government or reimbursed in one form or fashion. And in order to be reimbursed, we actually have to go through a competitive process. For those smaller no quote unquote no bid contracts, they are $34,000 contracts. I believe that is the latest amount, and we still have to go through a competitive process. So we're still supposed to get 3 bids for those contracts. And so this idea that I can hand $10 million to one organization is just because we appreciate their work is farcical. That's not to say that I don't appreciate a lot of the efforts that have been made out there, and it's quite frankly why we entered into a competitive process around testing, is because I think we recognize the concerns, appreciate the concerns, and want to make sure that those concerns are addressed. But we want to make sure it's done fairly, and we want to make sure that we are able to be reimbursed for those expenses.
Second and final question. Is daily reporting of positive cases of COVID-19 on hold while the mass testing effort is underway in city jails?
So we are continuing to report symptomatic cases within the jails. And so we've had very few, if any, symptomatic positive cases that have turned up in the jails. We will reveal asymptomatic cases all at the same time when that testing is complete.
Thank you.
All right. Thanks, Ryan.
All right. Thank you, Ryan. We're going to go to Pat Loeb with KYW.
Hi, Mayor. The City Council President has sent a pretty strong message that Council is not going to approve your request for a tax increase for the school district. He wrote a letter to Joyce Wilkerson telling her she shouldn't count on it in the school district budget. Have you been working with them to try to get this passed, or do you still have hope that it might still pass?
Well, we just sent a letter today to the council president saying that what the legislature has done in voting for stable school funding for last year's levels would not require the tax increase, for the real estate tax increase.
Oh, okay.
The hole would be filled by what the House and Senate in Harrisburg has done. As a matter of fact, the Senate did it this morning. So we can step away. We can step back from that.
So you won't be asking for the real estate tax increase after all?
No.
Thank you.
Okay, thank you, Pat.
Remember, just one other thing I want to say in advance. This act of the legislature fills a hole for this year. Going forward, we're going to be in a situation with our schools that they're going to need more. I don't want to make it think like the problem has gone away. The immediate problem has been dealt with. Long term, we have to figure out a way, both with Harrisburg and Philadelphia, and hopefully a new administration in Washington, how to fund schools. And I'm not, as long as I'm mayor, I'm not stepping back on allowing our kids to go through what they went through in 2008, 9, 10. And we put everything back that they had, and we're trying to expand their opportunities. I'm telling you that unless we fund education, both city, state, and federal, and get our kids to a point where they can be educated and be a great resource pool for employment, we will never move the needle on our poverty rate. And to put off our kids' future because it's inconvenient today or because it's not politically popular, I think is a mistake. And it'll be a long-term problem for the city, and it's been a long-term problem for the city because we've never funded education the way we should.
Pat, are you good?
Yes, thank you.
Okay. Next, we're going to go to John Mitchell of the Tribune.
Yes, good afternoon. Where does the Black Doctors COVID-19 Coalition stand in terms of receiving funding? Have they received any funding, any support from the city? And for an organization that's pretty much generated its own work in serving the Black community, do you just they're running low on funds. So how do you sustain an organization that has done what it's done so far? Because they're about to test their 5,000th person.
So that organization has put in an application under the request for proposals that the health department put out. And so there will be evaluated whether they should be funded for unreimbursed costs. Now, I should just point out, though, that request for proposals requires the people doing the testing to bill insurance for the testing. And most organizations are able to cover their costs through the insurance reimbursement from that billing. However, the RFP does say if there are unreimbursed costs after that billing, then this is what this funding is eligible for. And the RFP wants them, is looking for people who will test populations that might otherwise not be tested or at very high risk for getting infection or getting complications on infection. And so they're eligible to apply for that, and they put in an application and it's being evaluated.
And John, I do just want to mention that we have provided some personal protective equipment as late as last week. I know our Office of Emergency Management did drop off some personal protective equipment, as well as some technical assistance as well through the University of Pennsylvania was offered. I think the other important thing to note is that we have not entered into contracts for testing at this point with anyone. And so the RFP was really an effort to try and get to those harder to reach communities that we recognize we have not done as good of a job as we should have. And that'll be the first contracts we enter into as it relates to testing.
Thank you.
Okay, thanks, John. We are going to go to Claudia Lauer at the AP.
Hey, how are you? I know you've been releasing this information as it's become available, but I was hoping that we could get more information about the jail testing. Specifically, I was wondering if we could know what kinds of tests are being done. Is it nasal swab or is it saliva swab?
My understanding is it's nasal swab. Dr. Farley, is that your understanding as well?
Nasopharyngeal. Okay, so yes, in the nose.
Great, that's one. Two, do you know what progress you have made at this point? Like, can you say what percentage is done?
I don't know the exact percentage, but they've made tremendous progress, and we have every expectation to be complete next week.
Next week, that was my next question. So do you have a deadline for when you plan to report the results?
I can't tell you exactly what day we're going to report the results, but I do expect the results next week.
Great, thank you.
Yep.
Thanks, Claudia. We're now going to move into our second round of questions. We're going to go to Matt Petrillo of CBS 3.
Hi there. Thanks for taking our question. Just a little bit of clarification about the $92 million that was discussed in yesterday's budget hearing with the health department. What about that contract isn't standard. The council president said that how the money is being distributed wasn't standard, that it didn't go through a bidding process.
So let me be clear that $92 million is a grant that we received from the Centers for Disease Control to do testing and contact tracing over the next 2.5 years. $92 million is not an amount of a contract. Let me say that again, because there's a lot of confusion about that. $92 million is the grant we received from the Centers for Disease Control. The 2.5 years, it'll be used for many, many different purposes. What we have done is we have initiated contracts with 2 organizations to provide staffing support for contact tracing. That's the administrative function, which I just talked about. And so that they basically provide salary, payroll, and benefits for people that we hire and we manage as we would manage our own employees. That was a mechanism by which we could get staff on board very quickly so that we could do the contact tracing because we were in a hurry to do that. We did that as an amendment to existing contracts with these organizations so we could get it up quickly. And we do amend contracts all the time. So I don't know whether you consider that to be standard or not, but that's the mechanism by which we can respond to an emergency like this.
And Matt, I do actually want to reiterate something Tom just said, because I think it's really important to make sure it's very clear. These were 2 existing staffing contracts that the health department held that were amended specifically for contact tracing. And they were not for $92 million, but for a very small portion of administrative functions only.
Okay, so how are you able to say roughly how much these 2 organizations are going to be receiving from that money? And again, I understand that these contracts were amended, and I think that's why some council members are irritated, is because typically it seems like a bidding process was sidestepped because of those amendments.
Well, let me just say that for us to even just initiate a new contract typically takes us months, about 3 months. And I don't think it would make sense for us in this emergency to initiate a new contract. So we needed to move quickly. That's why we amended an existing contract. And what these organizations will get out of this is a relatively small administrative fee on the cost of the salaries and benefits.
And that fee is currently being negotiated. And certainly we will be sharing that in the entire budget of the $92 million grant with council when it's complete. We literally found out about this grant last week, probably less than 10 days ago, right?
About 10 days ago.
Yeah, so I think we're still working through that. And we certainly understand council's concerns about the contracting process. But I also want to make reference that these are 2 nonprofits. They are not owned by anyone. They're nonprofits that do a whole lot of work with the city and have done a lot of great work for the city in both our Department of Human Services, our health department, and our Department of Behavioral Health.
Okay, and so thank you for your time. I appreciate it. Last question. So is it possible that minority organizations are going to receive funding from that CDC grant?
It's absolutely possible. That is $92 million for 2.5 years for testing and contact tracing. Many different activities as part of that. And so there are many different ways we'll end up spending that money over that time period. What we're just talking about now is just the very first piece of this, which is just the staffing contract for contact tracers.
Yeah, and I would actually reiterate, it's not just possible, it is my expectation that we'll be funding minority organizations.
Okay, doke. Thanks for your time. Appreciate it.
Thank you, Matt. We are going to move on, and we're coming up on time here. Let's go to Sean Walsh of the Inquirer.
Thanks very much. Could you provide an update on the layoff situation? We heard that a number of exempt employees are being laid off.
Yes, I think I've already confirmed that a number of exempt employees are laid off, and we've testified in council to that.
All right. Did you provide a specific number or other?
I don't know if we've provided that to council yet. I'll circle back. If we've provided with council, I have no problem sharing it with y'all.
Okay. Is there any other breakdown of the layoffs that are planned that you can share now, including with representative or?
I want to make sure that our partners in city council see the information prior to showing up in the newspaper. So I want to circle back with that communication.
Thanks. And Mayor, on the property tax increase, was council's opposition a factor in your decision to not pursue it further?
The factor was the legislature decided to pass a budget that funded the gap that we were trying to plug with the proposed real estate tax. As soon as the Senate did that this morning, we were free to step away from the proposal.
And the other revenue enhancements planned in the budget are still going forward?
Yes.
Thanks. And then lastly, for Dr. Farley, with the metrics and the guidelines that the city is working on, independent of the state, is it safe to assume that you could describe in both of those areas that they would be tighter or more restrictive, or however you want to phrase it, than what the state has?
Well, the metrics are going to be just a more complete picture of what's happening in Philadelphia, and we have access to data that they don't have. So I'm not sure I would describe that as tighter or looser. And as far as whether we'll be tighter on what the restrictions are, let me just defer that to tomorrow when we lay out the plan.
Okay, thanks very much.
Thanks, Sean. Our last question goes to Manny Smith at CBS 3.
Hey, two questions for you guys. We've heard some reports that there may be some counter protests related to Minneapolis here in Philadelphia. Have there been any different deployments or plans or contingencies set up for that, Brian?
So we have some contingencies in place. I actually, as we were on this press conference, I was made aware of a specific deployment that we are taking for precautionary purposes. So we're going to continue to monitor social media and we'll respond appropriately.
Okay. Is that particular place a place across the street from where I used to work?
I'm not going to comment at this point. Happy to have an offline conversation.
Okay. All right. No problem. I'll do that by email. And then one more quick thing. We just really want to understand the discussion that came out of City Council, which you guys saw got very, very heated. So just in us taking this in context of the station, it was kind of like, hey, when you guys started the budget process, it says, hey, that we were going to make these decisions with the lens of racial equity. And so it kind of sounded like what council was asking for yesterday was through that lens, but you guys are pushing back on that. Can you help us reconcile those two different things happening at once?
These are federal dollars that need to be accounted for, and there needs to be a process that we enter into and can stand up when we're asked or audited by the feds. So I mean that, and in the mix of that process is the consortium, another company, and we expect a couple more submissions that we can evaluate. Bending the procurement rules when it comes to federal dollars is not something we can do, and we're anticipating being able to have a diverse group of people doing testing and doing contract tracing with the backup of the contracts that have been being conformed now, to have those companies there's nonprofits deal with payroll and taxes and all the other things that the back of the house operation needs to do once we start sending out those new employees to do that work.
I do want to, and Manny, I understand council's frustration. Any service reductions we have in this government, no matter what that service reduction is going to have a disparate impact on our most vulnerable citizens, which in large part are Black and brown communities. And so whenever we've had to make a budget decision, that is going to have a disparate impact. And unfortunately, in this budget, facing an unprecedented and historic budget deficit, we're going to make decisions that are going to have a disparate impact. And what we tried to do, and we probably didn't succeed all the time, but what we tried to do was to make sure we lessen that disparate impact to the best of our ability. And if council has other ideas, I think we're happy to hear them. This is not, I had a great conversation with council leadership last night. We're partners with them. And I think we sincerely believe that. And we're going to misstep. We're going to disagree at times, but in the end, we're going to have to come together and make some agreements. And so just because we had a heated conversation, so to me, it's sort of like arguing with your brother. You're going to make up in the end and figure out a path forward. And Just want to reiterate what the mayor said yesterday about Dr. Farley, consummate professional that really only cares about trying to do what's best for all of our residents, no matter where they live, or how they, or how much money they make, or what color their skin is.
We appreciate your candid answers, guys. Thank you very much.
Thank you.
All right, thank you, Manny. And that concludes our daily briefing for today. We will see everyone back here tomorrow at 1 p.m. Thank you.